I now call the National Forum for Heart Disease and Stroke Prevention's 2024 annual business meeting to order. Members will vote today on two matters: the approval of the Treasurer's Report and the election of directors. Each National Forum member organization has one voting representative. Voting today is via a poll question on your computer screen. If you're a National Forum voting representative, please vote. There will be 15 seconds to submit your vote on each question. If you have new business to bring before the membership, please use the chat function to bring it to the chair's attention before Dr. Melnick calls for the new business at the end of the meeting. For today's virtual meeting, the Zoom events attendance record will be used instead of a live roll call of members. Minutes from the October 26, 2023 annual business meeting are in the program book. Does anyone have any corrections? If yes, please place them in the chat box. If there are no corrections, they will be automatically approved by being on the consent agenda. We have no changes in the chat box, thus the minutes are approved. Mike Kropp will now give the Corporate Operations and Finance report.
Thank you. It's my pleasure to deliver the Treasurer's Report. And on the slide, you can see with the various accounts that we have a total cash and receivables of $2 million and roughly $132,000. Now that equates to about 13 months of operating expenses. So we're in a very strong position with our cash and receivables. If we go to the next slide, this outlines where we stand with our cash and receivables on the balance sheet in 2024 relative to 2023. And you can see that we're a bit behind where we were in 2023. And as we look to the changes in the net assets between 2024 and 2023, what we're seeing is that there's been a significant change in the revenues coming in 2024 relative to 2023. This is largely due to a significant grant that we did not receive from the CDC that we had been expecting, and some timing with respect to corporate contributions. So we are behind where we stood in 2023. But if we go to the next slide, we know that with the National Forum, the differences month to month and year to year are often a reflection of the timing of the revenue flowing in and the expenses that we have. So as I mentioned, in our position of cash and receivables, we're still in a very, very strong position. And we have a number of grant proposals out there that will hopefully begin to make up some of the gap that we see between 2023 and 2024. So that concludes my report, and I will make a motion to accept the Treasurer's Report as presented.
I second the motion. I'd like to now call for approval of the Corporate Operations and Finance report.
Okay, voting polls are open. They'll be open for about another 10 seconds. Please register your vote. Calling for last votes, please. And voting is closed. Here are the results.
Great, we have the results, and I now this item is now approved. We will now move to the Executive Director's report.
Marcus Plescia covered many of the past year's key achievements in his report, and Mike Kropp covered the National Forum's financial health in the Treasurer's report. I will not take your time to repeat that information. Instead, the Executive Director's report will focus on the National Forum's future direction. Working together multiplies our collective strength. That is both the function and strength of the National Forum. We gain further strength with the addition of 6 new members in 2024. Aledade, the City of Streator, the Kansas Pharmacists Association, the Medical Fitness Association, the National Fitness Campaign, and the Village of Maywood. You heard in the Association of Black Cardiologists video that our joint policy statement on expanding people's access to care has contributed to 32 states enacting 75 policies. We are updating that joint policy statement and expect this refresh in advocacy by the Value and Access Collaborative to result in more policy changes in 2025 and 26. The Value and Access Collaborative recently released a new co-branded shared decision-making guide on atrial fibrillation. We will mount a dissemination and implementation campaign into 2025. The National Forum will continue to provide briefings on timely issues affecting cardiometabolic health and health equity. For example, last month we held a briefing on the 340B drug pricing program, an under-the-radar program that affects healthcare access for underserved communities. Attendees said the briefing significantly increased their understanding of the program and issues. That increased understanding will enable more stakeholders to add their voices to discussions about the 340B program and propose changes to it. We will continue to expand Move with the Mayor to empower more people in more communities to attain good cardiometabolic health. The 2 things that excite me about Move with the Mayor are, first, it demonstrates that population health transcends partisan divisions. We involve Republican, Democratic, and nonpartisan mayors in urban, suburban, and rural communities. They're rowing in the same direction, aligned with the vital conditions for health and well-being. Through Move with the Mayor, they are taking action to give everyone a fair opportunity to make healthy choices and attain health and well-being. Second, we work with mayors to implement evidence-based policies, programs, and environmental changes. Cities that report data to us have implemented an average of 9 community guide interventions. Because the interventions are in the community guide, we can extrapolate their magnitude of impact. For example, a systematic review of evidence found that providing social support interventions in community settings leads to a 44% increase in time spent being physically active. Data provide information that makes a case. Stories humanize that data and motivate policymakers and other decision makers to act. Move with the Mayor produces compelling real-life stories about evidence-based interventions to improve cardiometabolic health. I'm pleased to report that your National Forum is 88% of the way toward it reaching its White House challenge goal, even though the deadline is December 2025. As issues arrive that affect people's opportunities to attain health, the National Forum will continue to collaborate with trusted messengers to illuminate the facts about these issues. For example, we have amplified mayors' and clinicians' voices about how pharmacy closures affect underserved communities. In the real world, that advocacy translates to bipartisan support for legislation that would expand people's access to vital healthcare services. One such bill, ECAPS, may be included in a legislative package in Congress's lame duck session. The Board of Directors, including the new members you will elect in a moment, will update the National Forum's strategic plan for 2025 and 26. Finally, thank you for your involvement in the National Forum. It exists to help you accelerate your organization's achievement of its goals related to the National Public Health Action Plan to prevent heart disease and stroke.
In a moment, voting representatives will be asked to vote on the nominees for 2-year terms on the National Forum Board of Directors. You will vote in the pop-up window on your computer screen. The Governing Committee and Board nominate the following slate of candidates for the Board of Directors for a 2-year term from 2024 to 2026. If you're a voting representative of a National Forum member, please vote in the pop-up window on your screen. Dr. Robert Hilkert, Dr. Maureen Litchfeld, Dr. Modele Oganiyi.
Okay, voting polls are open. They'll be open for about another 10 seconds. Please register your vote. Calling for last votes, please. And voting is closed. Here are the results.
Great, thank you. We now have a slate of Board of Directors. Please note the Board of Directors elected the 24-26 officers on October 3rd, 2024. Dr. Bern Melnick will now become your chair. I will become the past chair. Dr. Mike Kropp was elected as the incoming chair, and Dr. Celeste Phillip was elected as the Secretary-Treasurer.
The National Forum Honors 2024 Awards. I'm Julie Harville, and I'm joined by Stacy Resendez. The National Forum normally recognizes individuals and organizations who have made exceptional contributions to heart disease and stroke prevention. We are sorry we are not all together in person. However, we have received acknowledgments from the award recipients whose remarks we will share with all of you. The National Forum has presented 101 awards since the program began in 2009. Today, we will present 6 new awards. National Forum Heart Healthy and Stroke Free Award, presented to an individual whose work embodies the recommendations of the National Public Health Action Plan to prevent heart disease and stroke. Dr. Lawrence Sperling.
Your leadership, work in Million Hearts, and teaching have been instrumental in advancing public health initiatives. Your commitment to promoting heart health has had a profound impact on reducing preventable heart attacks and stroke across the U.S.
I'm humbled and honored to receive the National Forum Heart Healthy and Stroke Free Award on behalf of many. The Million Hearts team, partners, and inspirational individuals dedicated to the prevention of heart attacks and strokes across the nation. I'm truly grateful, and this is such a special honor. Thank you so much.
National Forum Heart Healthy Stroke Free Award is presented to an organization whose work embodies the recommendations of the National Public Health Action Plan to prevent heart disease and stroke. Hearts of Sonoma County.
For exceptional collaboration in preventing cardiovascular disease and stroke in Sonoma County, by uniting over 20 organizations, sharing best practices, and developing innovative strategies, Hearts of Sonoma County significantly improved blood pressure control during the COVID-19 pandemic. Your commitment continues to save lives and advance health equity. Accepting the award is Dr. Monica Ferguson.
I'm very honored to accept this award on behalf of Hearts of Sonoma County. We are a collaborative between both healthcare organizations and community-based organizations that has been meeting monthly for 10 years now to try to reduce cardiovascular disease in our community. So I would like to thank all of our members for their work. And we hope we can be an inspiration for other communities to prevent heart attacks and strokes across the nation. Thank you.
National Forum Public Policy Award, recognizes an individual who has been effective in advancing policy change that reduces the heart disease and stroke burden on a national, state, or local level. Mayor Aquanetta Warren.
For leading Fontana's investments in evidence-based infrastructure improvements to make active transportation accessible to more people, including students and underserved residents.
I am ecstatic about receiving this award. This means so much for me. Through the years, and I mean a couple of years, I have been working very hard with the United States Conference of Mayors and other groups to make sure that the bipartisan infrastructure bill was passed. But having the pleasure of being at the White House when President Biden signed that particular legislation and being allowed to speak and covering for all the governors and mayors, there has not been anything in my life in a long time that exciting. But what's more exciting is the great work we as a city have done to connect people through the right ways, not just car activity, but bike lanes, walking, having presentations. And we will continue to do that program because it works. We at one time had a large obesity level for our children. And I'm happy to tell you our baseline is going down, which means we're teaching our public the right way to eat. And more importantly, we're using our facilities all over our city to make sure people are engaged in healthy activity.
National Forum Public Policy Award recognizes an organization that has been effective in advancing policy change that reduces the heart disease and stroke burden on a national, state, or local level. American College of Cardiology.
For ACC's exceptional collaboration and leadership to advance evidence-based policies that enhance access to cardiovascular health and improve equity.
I'm Dr. Richard Kovacs, the Chief Medical Officer for the American College of Cardiology. The ACC is honored to receive this year's Public Policy Award from the National Forum for Heart Disease and Stroke Prevention in recognition of our ongoing work to advance evidence-based policies and enhance access to cardiovascular health care and improve equity. Ensuring patient access to the right care at the right time is key to achieving the mission of the American College of Cardiology to transform cardiovascular care and improve heart health for all. On behalf of the ACC, thank you for this award.
National Forum Commitment Award, given to an individual who has made outstanding contributions to the National Forum. Dr. Marcus Plesha.
For your unwavering dedication, insightful guidance, leadership, and inspiration that have helped strengthen the National Forum's impact on cardiovascular health and health equity.
Well, thank you very much. I'm very humbled and flattered to receive this award. I have really enjoyed my time on the board of directors and as the president or chair of the board over the last few years. I'd say my commitment to the National Forum mirrors the National Forum's commitment to the issue of cardiovascular health and health equity. It's been a real pleasure to work with the other board members and all of the members of the National Forum, and particularly with the staff. It's been a busy and active last couple of years with the National Forum. Everybody has worked very hard, and I think we have a lot to show for that. And I'm very flattered that you all would honor me with this recognition, and I really appreciate it.
National Forum Chair Recognition Award. The Chair's Recognition Award recognizes extraordinary service to improve health equity and optimize cardiovascular health and well-being throughout the lifespan. Dr. Letitia Presley Cantrell.
For your service in the fight against heart disease and stroke and your continued efforts to improve cardiovascular health in underserved communities, your leadership in advancing health equity and reducing health disparities has made a lasting impact on heart and brain health nationwide.
Good afternoon, and thank you to the National Forum for Heart Disease and Stroke Prevention for this award. I appreciate the recognition for the work that I do to advance heart disease and stroke prevention, or should I say the work that we do, because I do not do this alone. I have an incredible team of public health professionals working with me. But most of all, I carry my late grandmother with me. She is always with me, reminding me that there are so many people, especially women like her, who will benefit from what we're doing to ensure that they have healthier, longer lives. Thank you again to the National Forum for this honor.
Tribute to outgoing leadership. Dr. Warren A. Jones.
For your outstanding leadership and commitment to cardiovascular health and health equity.
Hello, everyone, especially my friends and family from the National Forum for Heart Disease and Stroke Prevention's family. I've really enjoyed working with you this last 9 years, and most importantly, having had the pleasure of serving on the board and as the board of trustees. This honor really touches me deeply, and I want you to know I'll continue to work for our goals no matter what. We know this is personal for me, with my daughter having died from heart disease. I don't want other families to go through what I've been through. So thank you for thinking of me during this time. Thank you for honoring my service, and I wish the best to everyone.
Incoming leadership. 2024-25 National Forum Board of Directors. Officers and Executive Committee members. Dr. Bernadette Melnick, Chair. Dr. Michael Kropp, Vice Chair. Dr. Celeste Phillip, Secretary Treasurer. Dr. Marcus Plesha, Immediate Past Chair. John Clymer, Executive Director.
Emeritus Founder, Dr. Darwin Labarth. Counsel, David Zook. Scientific Advisor, Dr. Stephen Sidney.
Directors: Juliana Crawford, Dr. Robert Hilkert, Dr. Maureen Lichtfeld, Rosemary McGillen, Dr. Madale Oganiyi, Dr. Ileana Pina.
Federal Liaisons, Elizabeth D., Dr. Lawrence Fine, Dr. Walter Koroshets, Dr. Brandon Taylor, Dr. Janet Wright.
This concludes the 2024 National Forum Awards ceremony.
I am so delighted to assume the chair position of this fabulous organization that's making such a positive impact across the nation. I would now like to call for any new business. If you have new business, could you please type it in the chat box? No new business has been submitted. So I will now make a motion to adjourn our meeting.
I second the motion.
Without objection, the annual business meeting is adjourned. To conclude the National Forum's 2024 meeting, I pass this on to our terrific Executive Director, John Clymer.